Installing a 15-amp receptacle on a 20-amp breaker does indeed pose a problem. The National Electrical Code, or NEC, requires that the ampere rating of a breaker match the ampere rating of the receptacle it protects. So, installing a 15-amp receptacle on a 20-amp breaker violates this code. This situation creates a safety hazard. If the receptacle is overloaded, meaning it draws more than 15 amps, it may overheat and fail before the breaker trips. This can create a fire hazard and significantly compromise the safety of both patients and staff, especially in a healthcare setting. In healthcare facilities, it is critical to maintain uninterrupted power to life-saving equipment, particularly during emergencies. The failure of a receptacle could result in a loss of power to vital devices, posing a significant safety risk to patient care. The recommended solution is to replace the 15-amp receptacles with 20-amp hospital-grade receptacles. This ensures compliance with the NEC and significantly enhances safety within the healthcare facility. Also, verify that the wiring and circuit protection are also rated for 20 amps to handle the increased load. Additionally, if the receptacles are being used for critical equipment, consider installing surge protection devices to prevent damage from voltage spikes. It is also important to train staff on the importance of using receptacles appropriately and avoiding overloading them. Overloading a receptacle occurs when the total current draw from devices plugged into it exceeds the receptacle's rated amperage. This can lead to overheating, melting of insulation, and potentially electrical fires. Regularly inspect electrical equipment and receptacles for signs of damage, such as frayed cords, cracked outlets, or loose connections. Damaged equipment should be repaired or replaced immediately. Implement a system for reporting electrical hazards and ensuring that they are addressed promptly. This could involve regular safety audits and training sessions. Ensure that all electrical work is performed by qualified and licensed electricians who are familiar with the NEC and local electrical codes. In healthcare facilities, backup power systems, such as generators, are essential for maintaining critical functions during power outages. Regularly test and maintain these systems to ensure that they are functioning properly. Follow the manufacturer's recommendations for maintenance and testing of electrical equipment. This includes regular cleaning, lubrication, and inspection of components. Surge protection devices can help protect sensitive electronic equipment from damage caused by voltage spikes. Install these devices at the point of use for critical equipment. Grounding is an important safety measure that helps to prevent electrical shock. Ensure that all electrical equipment is properly grounded. Use ground fault circuit interrupters, or GFCIs, in wet locations, such as bathrooms and kitchens, to protect against electrical shock. A ground fault circuit interrupter is a fast-acting circuit breaker designed to shut off electric power in the event of ground fault within as little as 1/40 of a second. It works by comparing the amount of current going to and returning from equipment along the circuit conductors. When the difference exceeds 5 milliamps, the ground fault circuit interrupter interrupts the power. Consider the specific needs of the healthcare facility when selecting electrical equipment and designing electrical systems. This includes factors such as the types of equipment being used, the number of patients being served, and the potential for power outages. Always consult with a qualified electrical engineer or contractor to ensure that electrical systems are designed and installed safely and in accordance with all applicable codes and regulations. Proper electrical safety practices are essential for protecting patients, staff, and visitors in healthcare facilities. By implementing these measures, you can help to prevent electrical accidents and ensure the safe and reliable operation of electrical equipment. Remember that electrical codes and regulations are constantly evolving. Stay up to date on the latest requirements to ensure that electrical systems are in compliance. Consider the long-term costs of electrical equipment and systems when making purchasing decisions. Energy-efficient equipment can save money on utility bills over time. Implement a comprehensive electrical safety program that includes training, inspections, and maintenance. This will help to create a culture of safety and prevent electrical accidents. Ensure that all electrical panels and equipment are properly labeled. This will help to prevent confusion and ensure that maintenance and repairs are performed correctly. Use appropriate personal protective equipment, or PPE, when working with electrical equipment. This may include gloves, safety glasses, and insulated tools. Be aware of the potential hazards associated with working with electricity. This includes electric shock, arc flash, and explosions. Follow all safety precautions and procedures to minimize the risk of injury. Regularly review and update electrical safety procedures to ensure that they are effective and up to date. Involve staff in the development and implementation of electrical safety programs. This will help to ensure that the programs are effective and meet the needs of the facility. Conduct regular drills to practice emergency procedures in the event of an electrical accident. This will help to ensure that staff are prepared to respond quickly and effectively. Maintain accurate records of all electrical work, including inspections, maintenance, and repairs. This will help to track the performance of electrical systems and identify potential problems. Consider the impact of electrical systems on the environment. Use energy-efficient equipment and practices to minimize energy consumption and reduce greenhouse gas emissions. Properly dispose of electrical waste, such as batteries and fluorescent lamps. These materials can contain hazardous substances that can pollute the environment. Support efforts to develop and promote sustainable electrical practices. This will help to create a cleaner and healthier environment for everyone. The National Fire Protection Association, or NFPA, provides a wide range of resources on electrical safety, including codes, standards, training materials, and educational programs. Take advantage of these resources to improve electrical safety in your facility. The Occupational Safety and Health Administration, or OSHA, also provides information and resources on electrical safety in the workplace. Consult with OSHA to ensure that your facility is in compliance with all applicable regulations. The Institute of Electrical and Electronics Engineers, or IEE, is a professional organization that provides technical information and resources on electrical engineering. Consider joining IEE to stay up to date on the latest developments in the field. The International Association of Electrical Inspectors, or IEE, is a professional organization for electrical inspectors. Consider joining IEE to network with other inspectors and learn about the latest code changes. Regularly attend conferences and workshops on electrical safety. This will help you to stay up to date on the latest developments and best practices. Read industry publications and websites to stay informed about electrical safety issues. Share your knowledge and experience with others. This will help to promote electrical safety throughout the industry. Work with your local electrical utility to identify and address potential electrical hazards. Participate in community outreach programs to educate the public about electrical safety. Support research and development efforts to improve electrical safety technologies. Advocate for policies that promote electrical safety. Remember that electrical safety is everyone's responsibility. By working together, we can create a safer and more reliable electrical system for all. It is important to verify that the wiring is rated for the appropriate amperage. The wiring must be able to handle the amount of current that the circuit breaker allows. If the wiring is not rated for the correct amperage, it could overheat and cause a fire. The type of wire used in the circuit will determine its ampacity, which is the maximum amount of current that the wire can safely carry. The NEC provides tables that list the ampacity of different types of wires based on their size, insulation type, and installation method. Ensure that the wire used in a circuit has an ampacity equal to or greater than the rating of the circuit breaker. For example, a 20 amp circuit typically requires 12 American wire gauge or AUG copper wire with type THHN insulation. If the wiring is not properly sized, it must be replaced with the correct size wire. Improperly sized wiring can create a significant fire hazard. In addition to the wiring, the circuit breaker itself must be rated for the appropriate amperage. The circuit breaker is designed to protect the circuit from overcurrents, which can occur when too much current flows through the circuit. The circuit breaker will trip or shut off the power to the circuit when the current exceeds its rating. If a 15 amp receptacle is installed on a 20 amp circuit breaker, the circuit breaker will not trip until the current exceeds 20 amps. This means that the 15 amp receptacle could be subjected to an overcurrent for an extended period of time, which could cause it to overheat and fail. To prevent this from happening, the circuit breaker must be replaced with a 15 amp circuit breaker. This will ensure that the circuit breaker trips before the receptacle is subjected to an overcurrent. Another important consideration is the type of receptacle being used. In healthcare facilities, hospital-grade receptacles are required for certain applications. Hospital-grade receptacles are designed to be more durable and reliable than standard receptacles. They are also designed to provide a more secure connection, which is important for critical equipment that must not lose power. Hospital-grade receptacles are typically rated for 15 amps or 20 amps. If a 15 amp hospital-grade receptacle is installed on a 20 amp circuit, it must be replaced with a 20 amp hospital-grade receptacle. This will ensure that the receptacle is able to handle the full current of the circuit. Surge protection devices are designed to protect electronic equipment from damage caused by voltage spikes. Voltage spikes can occur when there is a sudden increase in voltage in the electrical circuit. These spikes can damage sensitive electronic equipment such as computers, medical devices, and other critical equipment. Surge protection devices work by diverting the excess voltage away from the equipment and into the ground. This protects the equipment from damage. Surge protection devices are available in a variety of types and sizes. They can be installed at the service entrance, at the branch circuit panel, or at the point of use. Surge protection devices are an important safety measure for healthcare facilities where critical equipment must be protected from damage. In addition to the technical aspects of electrical safety, it is also important to train staff on the importance of using receptacles appropriately and avoiding overloading them. Overloading a receptacle occurs when the total current draw from devices plugged into it exceeds the receptacle's rated amperage. This can lead to overheating, melting of insulation, and potentially electrical fires. Staff should be trained to recognize the signs of overloading, such as warm receptacles, flickering lights, and trip circuit breakers. They should also be trained to avoid plugging too many devices into a single receptacle and to use power strips with surge protection. Regular inspections of electrical equipment and receptacles can help to identify potential problems before they cause an accident. Inspections should be performed by qualified personnel who are familiar with electrical safety codes and regulations. Inspection should include checking for damaged cords, cracked outlets, loose connections, and other signs of wear and tear. Any damaged equipment should be repaired or replaced immediately. A system for reporting electrical hazards is essential for ensuring that they are addressed promptly. Staff should be encouraged to report any potential hazards, such as frayed cords, sparking outlets, or trip circuit breakers. The reporting system should be easy to use and should ensure that reports are investigated and addressed in a timely manner. All electrical work should be performed by qualified and licensed electricians who are familiar with the NEC and local electrical codes. Unqualified personnel should not attempt to perform electrical work. Electrical work can be dangerous and should only be performed by those who have the necessary training and experience. Backup power systems, such as generators, are essential for maintaining critical functions during power outages. Regularly test and maintain these systems to ensure that they are functioning properly. Backup power systems should be tested at least monthly and should be maintained according to the manufacturer's recommendations. Follow the manufacturer's recommendations for maintenance and testing of electrical equipment. This includes regular cleaning, lubrication, and inspection of components. Proper maintenance and testing can help to prevent equipment failures and ensure that equipment is operating safely. Healthcare facilities should have a comprehensive electrical safety program in place that includes training, inspections, maintenance, and reporting. The program should be tailored to the specific needs of the facility and should be reviewed and updated regularly. The electrical safety program should be a part of the facility's overall safety program. Electrical safety is an important aspect of patient safety and should be given the highest priority.